Cereal always cuts up the roof of my mouth. But lots of people tell me that tortilla chips is what gets them every time. So no matter what the culprit, if you injure the roof of your mouth, here's what to do. Hi, my name is Whitney and I'm a dental hygienist here to talk about surprising causes for cutting the roof of your mouth and how to heal them. And before we get started, make sure to get my free oral care guide. Click the link in the description below or in the pinned comment to join thousands who have already discovered all the essential components for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. And having said that, for today's video, let's talk about the roof of your mouth. If you have ever cut the roof of your mouth, you know the pain and aggravation that comes with it. The roof of your mouth, also known as your palate, is made of soft tissues that can be very sensitive to temperature and pressure. And anytime you eat or drink anything, it can irritate or cut it or create sores. It's pretty easy to cut or burn the roof of your mouth, leading to pain or discomfort. These types of cuts can be minor or major, but you'll know they're there. A few of the most surprising and common causes for cutting the roof of your mouth are traumatic injury caused by eating hard or sharp foods such as cereal and chips, like we said at the beginning, as well as pretzels, hard crusty breads, popcorn kernels, and hard candies. Burns from high temperatures, foods or drinks such as pizza, hot coffee, soup, cheese, hot cheese, or tomato sauce. Extremely spicy foods that irritate the roof of your mouth can lead to a cut, like a lesion or something like that feels like a scratched palate. And recreational drug use, such as palatal perforation from cocaine. It's rare, but it can happen from high cocaine use. So how can we heal a cut on the roof of our mouths? Due to the difficult location, healing a cut inside of your mouth is a bit different from other cuts on your body. Cuts anywhere in your mouth can be a pain to deal with, especially since you can't just put a bandage on them. However, they often heal faster than cuts elsewhere on your body due to the quick turnover rate of the cells inside of the mouth. For smaller sized cuts on the roof of the mouth, you don't need to do much other than rinsing with salt water, giving it some time, and monitoring the cut to make sure it doesn't get infected. Small cuts, which are typically superficial and small in diameter, these ones will usually heal within a few days to a week. With deeper cuts comes longer healing time and possible interventions needed from your dental provider. Seeing your dentist can help to eliminate possible infections that could be serious. Typically, deeper cuts are the result of some form of trauma or injury, creating a very deep cut that can progress a hole into the palate. A hole or a perforation in the roof of the mouth is usually the result of excessive cocaine use, like we mentioned, and it is a very serious condition because the risk of infection is extremely high. But for minor sores, injuries, or cuts in the mouth, a gentle warm saltwater rinse can help aid in the healing process as well as offer gentle pain relief. Typically, recommendations are to use 1 teaspoon of salt in a 1 cup of warm, not hot water. And if the warm water is irritating to the cut, colder water is okay to use. Salt water is a natural way to help clean and promote the healing of cuts, sores, or even sore throats because of the osmosis effect. Osmosis occurs when the salt draws out liquids within our cells, reducing inflammation. If these cells contain bacteria within the liquid portion, it will be drawn out, which leads to a cleaner mouth with fewer bacteria. Science! Rinsing with a saltwater solution is a quick and easy way to speed up healing and reduce the risk of infection. But overall, most of the time, a cut on the roof of your mouth is not going to be an emergency. However, if the cut does not heal, if it's causing extreme pain or discomfort, or if it's actively bleeding or has any pus draining from it, it's time to call your dentist. Typically, cuts in the mouth will start to feel better within a few days. During these healing days, you want to avoid smoking, avoid spicy foods and hot beverages, because this all can delay healing. So give yourself some time and rinse with the salt water. Also be sure to keep up with your home care of brushing 2 times each day and flossing and or cleaning between your teeth 1 time each day to keep your mouth as clean as possible to reduce the risk of infection entering the cut. And to keep your mouth as clean as possible, sign up for my free oral care guide to create the perfect oral hygiene routine and join thousands of people who have already discovered all of the essentials for an effective oral hygiene routine. This guide is an action plan for preventing and maintaining a happier and healthier smile. It's linked below in the description and in the pinned comment. And I hope this video helped you. Please like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth. And it's okay to keep eating cereal. I love cereal. It always cuts the roof of my mouth, but after it cuts it, I just give it a few days, let it heal, and then I'll eat some more cereal.